Welcome back. In your morning medical news, new safety concerns emerged for a mosquito virus vaccine, especially for older adults. The FDA now recommends anyone over 60 avoid the newly approved chikungunya vaccine. The pause comes after 17 adverse reactions worldwide, including 2 deaths, were potentially linked to this shot. The manufacturer of Valneva defends its safety standards, suggesting patients who experience problems could have had underlying medical conditions. A new Senate committee report reveals the Trump administration has cut $2.7 billion from the National Institutes of Health, nearly $1 billion more than earlier estimates. The Senate Health Committee's minority staff called it a war on science and demanded an end to the research funding cuts. It is a problem your parents probably didn't have to worry about, but we do. How to handle a child's screen time and keep them safe online. Experts say the best way is to start with talking to your kids about your concerns. Christian Benavides explains.
They're gonna be flowers, Mom.
As 8-year-old Elia blossoms into a young adult, her parents know sunlight, not a screen's blue light, will help her to grow.
I am a little afraid of what I'm gonna have to face the older she gets. But I'm also realistic in knowing that this is just the world she's growing up in, so I have to have real conversations with her.
Sia Chekwa and her husband keep close eyes on the tablets their children use, but outnumbered 3-2, they worry about what slips through the cracks.
Is it age appropriate? Can someone talk to them on there? Is something going to pop up that I don't want them to see? Those are our biggest concerns.
That's a concern shared by many parents. According to the Kids Mental Health Foundation, the top fears parents have around screen time are privacy and safety concerns, exposure to misinformation, and not socializing in person.
We know that kids that spend more than 3 hours on social media a day have higher risk of things like depression and anxiety.
Ariana Howitt is the foundation's executive clinical director. She recommends explaining time limits and potential consequences ahead of time.
Kids, their brains are developing. We cannot expect them to set their own boundaries. Kids are not going to put their phone away on their own.
8 in 10 parents say they actively do something to manage screen time. The Chekwas set time limits. They also get help from Elia, who keeps tabs on what her little brothers are watching.
When you're busy with work and you're running around making dinner and all those things, just making sure that everyone's on the same page in the household, I think is important.
Keeping the family on the same page as the kids travel the digital world.
And when it comes to managing your kids' screen time, setting firm time limits proves most effective. Other top strategies include encouraging offline activities and using parental control apps. Turning now to some local medical news, another hospital is planned for the Chippewa Valley. Clear Sky health officials say a new 36-bed facility will soon open in Eau Claire. The new hospital will specialize in treating patients recovering from strokes, brain injuries, and other complex conditions. Officials say the 45,000 square foot hospital will create about 100 jobs and treat more than 650 patients annually when it opens mid-next year. A free wellness event celebrates Mental Health Month in Black River Falls today. The Jackson County Department of Health and Human Services hosting its 3rd annual Wellness Extravaganza from 4:30 to 7:30 at the Milt Lunda Ice Arena. Highlights include a community art project, substance use education displays, and interactive wellness stations. The event offers free meals and county transportation for residents who need it. The American Red Cross held another successful blood drive yesterday at the La Crosse Library. Organizers say these local drives become even more critical during the summer months when blood supplies typically drop, but demand stays high.
We're busy, things are going on, there's people are traveling, camping, doing outdoor activities, so blood donation falls kind of to the bottom of the priority list. So it's important for people to think, as we have extra daylight to do things throughout the day, think about giving an hour of your time to donate blood.
If you want to give blood, you can visit the Red Cross's website for a schedule of upcoming opportunities.